Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi, who is a very renowned gynecologist and obstetrician in Udupi. And she was the past president of IMA in Udupi, but now she is the president of Manipal OBG Society also. And apart from her profession, she has been serving the people by educating them through the radio talks and the television shows and the lectures. And apart from that, she has also written Vatsalya the Osuge. Now it has already over and it has come to the second edition and that popularity. But today, let us welcome her. Namaskar, Rajalakshmi. Welcome to our show.
Namaste, ma'am. Thank you. Thank you for the opportunity.
You know, young women, they don't have the past history or the family history of hypertension, but when they become pregnant, they develop hypertension. Now, what is the cause for that? What is it called as?
Yes, ma'am. See, we were previously calling it as pregnancy-induced hypertension, PIH and all. Now, present day, it is called as hypertensive disorders of the pregnancy, where we see elevated blood pressure more than 140 by 90 millimeter of mercury in a pregnant lady. It can be seen first time during pregnancy, or maybe she had it and it became evident during pregnancy. Usually 5 to 10% of pregnant ladies do develop hypertensive disease in the pregnancy. So why it happens? Because of the there is some impaired blood circulation or impaired placentation in the mother. Placenta is the organ which supplies the nutrition to the baby. It has not developed well, or the blood vessels in the placenta have not developed well. That is why the blood pressure increases. Yes, ma'am.
So apart from this, what are the other risk factors? What are the other causes? One is the placenta implantation. What are the other causes?
Okay, there are some unique things. First is, it is usually seen in the first time pregnant lady, primigravida. So there we say immunity may be the reason, because a part of the baby is from the paternal part. So it is foreign to the mother.
Fighting among themselves.
They are fighting. Some immunologic factors can be there. And it is usually seen in a very young lady or very old lady, elderly lady who gets pregnant. So extremes of the ages. And if the mother, the antenatal lady is obese, if she has a past history of hypertensive in her previous pregnancy, or her mother or her sister, elder sister had hypertension, or there is a history, family history of hypertension, diabetes, kidney problems, so she can also develop. Even multiple gestation, when she's carrying 2 babies or 3 babies sometimes because of the IVF nowadays, she can develop hypertension. The BP can go above 140, 90 millimeter of mercury. So these are the causes and the risk factors.
Yeah, when you said the kidney, I realized, one of my patients, she had the renal artery stenosis. That means the artery going to the kidney was stenosed. So I had to open it after covering her abdomen so that the baby is not having radiation. And also aortoarthritis patient, she was pregnant and the BP was high. So there, it becomes very difficult and it is not recorded because they don't go to the doctor until they are pregnant. And that's the reason they are all silent killers and good that now the obstetricians are insisting on recording the BP regularly. Otherwise, all these patients used to just die, I have seen the patient dying in 1970, in KMC. But I don't think now that is a problem because you are treating them. Now, what are the complications that can occur to the baby and to the mother due to this hypertension?
See, as you said, the antenatal care has improved nowadays. So we teach them what are all the warning signs when they have to come to us, like excessive weight gain, if they are swollen feet or swollen face, and if they feel giddy, if they have any visual disturbances, or if they have severe abdominal pain. So they come to us, we teach them. And every visit, they have a blood pressure check, weight check, everything. And if they are considered as high risk, we put them in a gestosis score. If they are considered a high risk, if they have some history, they will be given special care, extra care, and they have to visit the obstetricians more often. And so their weight will be recorded. They will be told how to follow up. Even we advise sometimes home monitoring of the blood pressure. So why do we do this is she can develop complications like bleeding, abruption, that is a separation of the placenta. She can have HELP syndrome where the platelets and all come down and she has bleeding. After delivery, she can have bleeding, that is called postpartum hemorrhage. That and dreaded one is the eclampsia. You asked. So eclampsia is a condition where she starts convulsing. She throws fits.
Yes.
So last she can lose the
resort, yeah.
Yeah, she can lose her life also. But with the improved our obstetric interventions, obstetric care, the death rate has come down now. But baby also can suffer. Baby is inside her. It is dependent on her. So the weight can come down. We might have to deliver her early because to save her, to save the mother, we might have to deliver early. So the baby will be preterm. It might need NICU care. And there are chances that it can die. Like I said, abruption, where the placenta separates before delivery, the baby can die inside the uterus also.
Yes, yes.
Yes.
Is there any way of predicting it that a lady can develop like this? Like, not like an astrologer, but scientifically?
No, it's the first one is the Gestosis score, where we calculate what are all her risk factors. There are some 12 to 15 points. If the score is more than 3, we put it, give more care for her. Second one is based on her weight and everything. As we screen for Down syndrome, we also screen for hypertensive disorders. We do Doppler, arterial Doppler, and we see whether they are prone. What are their chances? So in case we find they are screen positive, we start them on aspirin, low dose aspirin we start, and it can prevent the progression to hypertensive disease. We also ask them to take a high protein, low salt diet and give more calcium. They are given 1 gram of calcium every day along with magnesium because these are supposed to decrease the blood pressure and maintain a good flow. And third one and the most important is the regular checkup with the obstetrician. So that will help us to monitor her well and diagnose the complications very early.
Okay. So apart from this, any other management or specific advice that you would like to give to the patient?
One is if they have a family history of hypertension, maintain a good weight before becoming pregnant.
Okay.
That is the one good thing.
Weight. Okay.
Reduce the weight. And dietary modification, reduce their salt content. And make exercise a part of their life because exercise helps to reduce the
And
BP.
also sometimes yoga also can help.
Yeah, yoga that reduces to helps to reduce the stress. And I may sound little, I might offend some people, but please get pregnant within the bracket of 24 to 30 years. That will reduce the most number of the number of the complications. It is difficult to tell, but that is the optimum age because the health will be optimum and complications also will be less. So that is what we would like to tell them. And regular care, antenatal care, proper visit with the trained obstetrician, efficient obstetrician, and delivered in a well-equipped hospital. If you are known to be hypertension, so hypertensive patient, please you have to deliver in a well-equipped center. Space the pregnancy, use contraception. So these are all the things we would like to tell them.
Thank you so much. Thank you so much. You have so elaborately, so lucidly, you have explained to our viewers. And I'm sure the younger generation will listen to your words of wisdom. And then they will prevent death for themselves as well as for their babies. Thank you very much.
Thank you so much, ma'am. Thank you for the
opportunity. Let us all wish all the best to the younger generation. Get married early, have children early, and do not delay, and then see that your weight is maintained well. Thank you.
Thank you so much.